Okay, we're going to go and show distraction of the tibia from the femur. And there's a couple of different ways of doing it. I'm going to show you 3 different positions. The first one I like to do, since I have the patient close to me on this side, is I'm going to use my tricep, not my olecranon, to kind of get in position. I'm going to take the patient, position her into flexion of the hip, about 90 degrees. I get my tricep into the hamstring or into the back side of her, posterior side of her thigh. From this position, my hands are just proximal to the malleoli. I do a distracting force by trying to straighten out my elbows. Once again, I want to make sure my elbow's not into that thigh, that my tricep's in there so it's comfortable. Does that feel comfortable to you?
Yes.
Good. From there, I'm going to do my distracting force, and it's a distraction of tib on femur. Also, for some patients, it might be more ideal to take them, abduct them, get your body into this position. One leg's going to be forward, my hip is up against the posterior side of her thigh onto her hamstring. Once again, I position my hands. I'm not doing a death grip here. I'm getting my hands around her femur, around her proximal malleoli. And from this position, I'm just doing the same thing, gently distracting the tibia by trying to extend my elbow. Very gentle, very easy way to distract the tibia from the femur. Next, I'll have the patient positioned and sitting over the side of the plinth. I'll get into a chair and utilizing my legs, this is a very unique and valuable way to do this. I'm going to go and I'm going to cross my feet, and I'm going to have my knees or legs embraced just above her malleoli. From that position, my hands are going to be palpating at the tibial plateau. From this position, by straightening my knees, I can distract at the tibia. There's a distracting force. From that position, I can go into either do an external rotation or an internal rotation of tibia. The distracting force is taking place right through my legs. It might also be noted to put a towel or something underneath the proximal posterior side of the thigh so you're not cutting into that patient, cutting off circulation.